Good evening, everyone. Welcome to tonight's webinar, Cost Conversations, Patient Financial Resources Every Pharmacy Team Should Know. We're going to wait just under a minute for more attendees to come on, and the webinar is going to get started shortly. Okay, it looks like we've got a lot of people joining us. We're so glad to have you with us tonight. For everyone who's just joined, again, welcome to today's webinar, Cost Conversations, Patient Financial Resources Every Pharmacy Team Should Know. We are so thrilled to have so many pharmacists, pharmacy technicians, and other allied healthcare professionals with us this evening for this important topic. While we have attendees joining the webinar and getting settled, we're going to go over a few brief housekeeping notes before turning it over to our expert panelists tonight. We just go to the next slide, please. This live session is accredited for continuing pharmacy education credits by the Accreditation Council for Pharmacy Education. We'll have links and a QR code provided at the end of the webinar. For Q&A, please submit your questions throughout the course of the presentation in the Q&A box. There will be a dedicated Q&A session at the end, and we will try to get through as many questions as we can, time permitting. Live American Sign Language interpretation is also being provided throughout the webinar. And finally, there's going to be a lot of resources shared tonight. Following the webinar, you will receive an email that contains a copy of the presentation slides, a comprehensive list of all the resources mentioned, a recording of the full session, and of course, a survey to tell us your feedback on this webinar. With that, again, welcome to everyone joining us this evening for this important topic. I would like to turn it over to our panel of experts, Dr. Sarah Thomason, Dr. James Ridley, and Dr. Jessica McLaughlin, to introduce themselves and dive into this conversation. Dr. Thomason, I'll turn it over to you first to introduce yourself.
Thank you, Liz. Good evening, everyone. It's so great to be with you today to share more about such an important topic. I'm Dr. Sarah Thomason. I serve as chair and professor of pharmacy practice at the Gatton College of Pharmacy at East Tennessee State University. I'm a board-certified psychiatric pharmacist and serve as a clinical pharmacist at the ETSU Center of Excellence for HIV and AIDS Care. I also have the honor of serving on the board of directors for the PAN Foundation. And now I'm going to pass it over to Drs. Ridley and McLaughlin so that they can also introduce themselves.
Thank you. Greetings, everyone. Welcome. My name is James Ridley. I am the Director of Clinical Affairs here at the PAN Foundation, pharmacist by trade, patient advocacy, and advocate from my personal mission. And then here to just educate you all on the importance of resources that are available for patients. And then I'll pass it over to my colleague, Jessica.
Thank you so much, James. I'm happy to be here, and I'm so happy to be able to talk about some of the passions and the needs that we have for our patients. I am the clinical affairs specialist with the PAN Foundation, and I'm excited to get into the information today.
I'm pleased to share more about the sponsor of today's continuing education session. The PAN Foundation is a national charitable foundation and healthcare advocacy nonprofit working to accelerate access to affordable healthcare through provision of financial assistance, advocacy, and education. PAN offers over 80 disease-specific financial assistance programs for a wide range of life-threatening, chronic, and rare diseases that help patients pay for their out-of-pocket prescription medication costs. Since 2004, PAN has provided $4.5 billion in assistance to more than 1.3 million patients nationwide. Every year, PAN Foundation helps thousands of patients across all 50 states and U.S. territories access their treatment. In addition, PAN reaches millions of people each year through its advocacy and education efforts, providing opportunities for the public to advocate for access to care and delivering resources on complex healthcare access topics, such as Medicare reforms and clinical trial participation. The goal of today's session is to equip pharmacists, pharmacy technicians, and other healthcare professionals with practical tools that you can use immediately in your work to help patients afford their treatments. The things that we're going to cover include recent research on healthcare access and affordability, key financial assistance resources, overview of charitable foundations like PAN, and how to talk to your patients about affordability concerns. And then we're going to end with the questions and answers. This topic matters so much to me, both professionally and personally. The mission of the Gatton College of Pharmacy is to train progressive, team-oriented pharmacists who improve healthcare with a focus on serving rural and underserved communities. Ever since I completed a fellowship in psychiatric pharmacy, I've worked in medically underserved areas, regions of Virginia and Tennessee, and initiated a comprehensive patient assistance program within a family medicine clinic. Helping my patients be able to get the medications and treatment that they need, but can't always afford, has always been such an important part of what I do in caring for my patients. And I think it's really important for all members of our pharmacy teams to be aware of all the available financial assistance resources that are out there. As pharmacists and technicians on the front line of healthcare, we all have the ability to change lives by engaging with the charitable foundations and accessing these resources. So let's look at our learning objectives for pharmacists. You're going to be able to, at the end of this session, evaluate relevant research, identify available financial assistance resources, understand the role of charitable foundations and how to guide our patients through that enrollment process. And for our pharmacy technicians, you'll be able to recognize key trends related to access barriers, identify available financial assistance resources, and understand the roles of nonprofits like PAN, and learn how pharmacies can enroll patients into financial assistance programs. And so now it's my pleasure to hand it over to Dr. Ridley.
Thank you, Sarah. So I do want to spend some time focusing on the Center of Patient Research. And just for a little bit of background, the Center of Patient Research is PAN Foundation's research center where we aim to understand the challenges that are faced by patients and then translate those findings into actionable knowledge for healthcare providers, for stakeholders, policymakers to help inform policies and educational opportunities to lead to accessible, affordable, and equitable healthcare for all. The 2025 State of Patient Access Research Initiative is through the Center of Patient Research. And through this, it is a groundbreaking research initiative that surveys patients with chronic health conditions directly about the challenges they face in healthcare access and also affordability. The report uses a comprehensive national study conducted by the Harris Poll. So as an overview, the 2025 State of Patient Access Scorecard. Through this scorecard, you will see that the overall grade for the access among patients with chronic health conditions is a C. A grade of a C is not good, especially for healthcare. Through all of these measures, we understand that people have experienced negative impacts regarding their care based on identity, race, ethnicity, gender identity, sexual orientation, age, income level, and also insurance status. And we've given a breakdown of the bullets. Overall access to health, you see, comes in at a C+. The relationships with healthcare professionals, such as yourself, is at a B, but we know that that could be better. Affordability of prescription medications, a B-. Access to treatment, a D-, and then also financial toxicity coming in at a D+. So one of the findings is healthcare access and affordability is not getting better. It is actually getting worse. On this slide, you will see a comparative analysis from 2024 to 2025. And as you can see, some of the grades are staying the same, and also some of them are decreasing. And also, having health insurance does not even guarantee access to timely and affordable healthcare. And we are told that having healthcare is actually a privilege. I do want to highlight financial toxicity coming in at a D plus. That is a decrease from 2016. Financial toxicity is uh, is the impact of the mental and physical health associated with affording treatments for chronic conditions. A quarter of patients, 25%, said financial toxicity affects them a great deal, and then also half of the LGBTQIA plus patients surveyed say that they experience a great deal of financial toxicity due to the cost of healthcare. This is nearly double that was reported by non-LGBTQIA plus respondents. We're looking at Hispanic patients who rated financial toxicity at an F. African American patients, the rating dropped from a D in 2024 to a D minus in 2025. Unfortunately, this is the reality that we are living in. So, although and affordability of a prescription medication is also continuing to drop, and we know with affordability of prescription medications are going up, this decreases the adherence of patients and their medical outcomes. 27% of the patients with chronic conditions taking 5 or more prescriptions were in this survey, and more than 1 out of 3 patients worry that affording their medications in the future would be a great concern. Although affordability for prescription earned a B minus again this year, score dropped from 82.3 in 2024 down to an 80.8 in here in 2025. And the lack of affordability hits in the following groups. I'm just going to list uninsured people, Gen Z, people living with rare diseases, millennials, Hispanics, Alaska Native and American Indian, people in the LGBTQIA plus community, also African Americans, people in the urban areas, and people living in the South. So medical debt. Medical debt is a huge issue for patients. As you can see here on the chart, we have some patients that were surveyed who are in more than 10,000 plus in medical debt. And we think about medical debt is not just a bill, it's actually a burden that follows the patient long after the hospital stay. It follows them after the pickup of their medication at the pharmacy and also their physician visits. It wrecks credit, it drains savings, it keeps families locked into cycles of poverty, and far too many. A trip to the ER becomes a one-way ticket to a financial ruin. Parents delay care. Seniors, they ration out their medications. Young adults carry debt instead of a dream, all because healing came with a price tag they couldn't afford. And no one should have to choose between getting well and going broke. So this is why the awareness and the navigation of financial resources are so very important. Another one of the key findings is that we saw that 1 in 5 US adults and patients with chronic conditions reported being extremely or very familiar with financial assistance programs. That's not a lot. Also, 3 in 10 people say that they need financial assistance to cover the out-of-pocket costs for their medication. But also, 4 in 10 did not even end up receiving any type of assistance. Too many people they struggle in silence, unaware that help it does exist. While some ration pills, they skip appointments or walk away from life-saving treatments, financial assistance programs. Specifically to the PAN Foundation, we stand ready to offer that relief. But it is only if the patient know that we are even here. See, awareness is the first step towards access. For every person who receives support, countless others qualify but don't apply because no one told them that help was even available. And that is why this is very important that you stand at the forefront of dealing with the patients and being able to offer them different resources. That knowledge gap can be the difference between stability and crisis for a patient, and also between hope and hardship for them. Organizations like PAN, we exist to ensure that out-of-pocket costs don't stand in the way of care, but our impact is only as powerful as our reach. And we hope through you and spreading the word and awareness, more patients will know about different financial assistance. Raising awareness isn't just outreach, it's actually a lifeline for many. So now I will turn it over to my colleague, Jessica, who will speak to some of the resources for prescription medications.
Thank you, James. Um, why this matters. Many of our patients feel uncomfortable discussing the cost of medications, but open communication can lead to more affordable treatment options and better health outcomes for our patients. As a provider, you play an important role in empowering patients to have these conversations. There are several different types of financial resources out there available for your patients. First are the federal government programs. There is the Extra Help for Medicare patients. This program is commonly referred to as the Low Income Subsidy Program. It's available to patients enrolled in Medicare that need help, additional help to pay for out-of-pocket drug costs. This program is uh, limited income and resources requirements, so they do have to apply. We also, the PAN Foundation offers an online educational resource to better understand the program. There's also another program, AIDS Drug Assistance Program. This program is to help provide FDA-approved medications to low-income patients with HIV who have limited or no health insurance. Now we look at the state government programs that are available. Most of us are aware of Children's Health Insurance Programs, or CHIP. This provides low-cost health coverage, including prescriptions, to children and families that earn too much money to qualify for Medicaid. We also have state pharmaceutical assistance programs, or SPAPs. They're state-run programs that assist low-income senior and adults with disabilities to help pay for their prescription medications. These programs' coverage do vary by state, but they generally provide Part D, uh, what we call wraparound coverage, that they'll pay for costs that Medicare Part D does not pay for. And then we also have Medicare Savings Program. Um, these are state-run programs that help people with limited income and resources pay some or all of their Medicare Part A and Part B premiums, deductibles, and co-insurances. We then have your nonprofit programs. So there is independent charitable patient assistance foundations that provide financial assistance to eligible patients to help cover out-of-pocket costs for prescription medications. Some foundations also can provide premium assistance and other forms of financial assistance like travel. There's also a web-based application called Fund Finder. This application was created by the PAN Foundation that gives you a all-in-one resource for all of the charitable organizations out there. You are able to use this application. You are able to sign up to receive a text message or an email to alert you when a potential disease fund program is open. Everything is based off of disease state. So when you go onto the web application, everything is alphabetical and you can search for the disease state that you're interested in, and any available charitable organizations out there will be listed under that disease state. Lastly, we then have something everyone's very familiar with is your pharmaceutical manufacturing patient assistance programs. They offer assistance programs that provide financial assistance or free drug products to those who are uninsured or commercially insured who meet their income eligibility guidelines. The problem with pharmaceutical manufacturing patient assistance programs is they are limited in the patient populations that they're able to help. These programs are unable to provide support to patients who are enrolled in federally funded insurance programs due to federal guidelines. So these are several different tools that a patient can use, and you can help guide your patient to these to help lower their prescription costs. We've got the drug manufacturer coupons. There's other programs like GoodRx out there that help to lower drug costs, especially when it comes to medications that are not covered by insurance. There's also a program out there, RX Outreach, that tried to provide prescriptions to patients, to qualifying patients, at no cost to them. And then when you're looking at very specific patient, like prescription assistance programs, again, you've got Fund Finder, as we mentioned. There's the Medicine Assistance Tool, or MAT. There is another nonprofit program, Needy Meds. They encompass a plethora of resources, from programs like charitable organizations to drug manufacturing programs, as well as costs that are outside of prescription costs that a patient might need help with, like travel. We also have RX Assist and RX Hope that are available out there. So this is our knowledge check. So you will see a poll pop up on your screen for you to participate. In this, what resource combines all independent charitable foundation financial assistance programs in one place? All right, we'll just give it another minute. All right. All right, awesome. So out of all of the options you had available, we had 52 out of 58 responses that chose Fund Finder, and you would be correct. Fund Finder is a web-based tool, again, that was created by the PAN Foundation that offers all-encompassing charitable financial assistance programs in one place, based off of a disease state to help patients get the assistance they need. And I will turn it over to my colleague James to talk about specifically charitable patient assistance foundations.
Thank you, Jessica. So now we'll take a deep dive into charitable patient assistance foundations, such as the PAN Foundation, where we'll give an overview of what all of them typically cover throughout the organizations. So I just want to give a brief background of what charitable assistance foundations are. So these foundations are independent, nonprofit organizations, and they provide financial assistance to patients living with life-threatening chronic rare diseases to help cover out-of-pocket costs for their prescription medications. Some organizations provide other patient services such as financial assistance, such as transportation, also referrals to patient support organizations, patient advocacy, and education. Each charitable foundation operates independently, and they may vary in programs and services across the foundations. So the origins of charitable patient assistance foundations. So as Jessica mentioned earlier, as a resource, pharmaceutical manufacturers can assist uninsured and commercially insured patients through their programs. With charitable patient assistance organizations, we are able to help patients who are federally funded, such as Medicare, with their out-of-pocket costs for their medications. Also, understanding that patients in Medicare populations, they live on fixed incomes. They typically, at the age of 65 or older, or with a life-threatening disability, have chronic and multiple illnesses. They face challenges affording their out-of-pocket costs. And we know this because we reference back to our 2025 State of Patient Access Research Initiative. As a knowledge check, which of the following organizations have you previously heard of prior to this training? I'll give a few moments for you all to answer. Okay. Okay, so there seems like there's a distribution here. I am happy to say, being a part of the PAN Foundation, that is the highest percentage. But yes, these are all charitable foundations that offer financial assistance for patients. And now we will go into what they typically cover. So, charitable foundations offer co-stay assistance for eligible patients. Here is a list of some of the foundations. We have the PAN Foundation, of course, Assessia Health, Cancer Care, Good Days, Health Well, the Leukemia and Lymphoma Society, the National Organization of Rare Disorders, also known as NORD, the Patient Advocate Foundation, and also the Assistance Fund. So we're going to go back to Fund Finder because I'm going to dig in a little bit deeper. Jessica mentioned Fund Finder as a resource, and I think it is a valuable resource, especially for pharmacists and working in the pharmacies and technicians in regards to finding assistance for patients. We understand for patients navigating through living with their life-threatening chronic diseases, there's so much. And also with working in the industry, you don't have a lot of time. So, and we realized that there are 9 organizations. So what we did is at the PAN Foundation a few years ago, we created a free web-based app. And through this app, we combine all of the 9 charitable assistant organizations. And this allows you to track more than 200 patient assistant funds. Through this app, you can sign up to receive messages when the PAN Foundation opens a new disease fund, or you can actually link to a specific disease state and be notified if the PAN Foundation opens that disease fund or any other organization have funding available for your patients. You can visit the website at www.fundfinder.org and to create a free account, and again, to receive text messages from the web-based app when those funds are available. So, what can the charitable patient assistance programs offer for your patients? On this slide, this is an example of some of the disease states that the various charitable foundations cover. I would like to note here is how we different from pharmaceutical medication programs is that we are disease-based, meaning our disease funds cover all the medications that are FDA approved, compendia listed, or guideline listed for that particular disease state. We don't just cover a singular drug. This helps because if you have a patient, as mentioned, they may have a particular disease state and are on 5 medications. They will receive out-of-pocket cost coverage for all 5 medications that are included in that fund versus just one particular medication. So through the charitable foundation, we all typically offer copay assistance, and through copay assistance, essentially that is medication copays, deductibles, and also co-insurances. Premium assistance. We know with the rising cost of insurance premiums, there's a great need for patients to receive help around their premiums. And then also transportation assistance. Through going out and doing boots on the ground work, we often hear that transportation is one of the largest barriers for patients receiving access to their health care. And a lot of the organizations, including the PAN Foundation, offers transportation assistance to help patients alleviate that barrier. Coverage of medications. So usually the foundations cover all medications, as I mentioned earlier, all the medications that are listed under the disease funds that are generic or bioequivalent drugs that are FDA approved or compendia or guideline evidence-based listed. They do not usually cover medical services, office visits, lab work, products that are covered 100% by the insurance, or products billed through discount cards. So in talking about general eligibility, I will say across the charitable organizations, they typically have eligibility criteria. So as an example, at the PAN Foundation, for all of our disease funds, we have an eligibility criteria where the patient has to be getting treated for the particular disease state. They have to reside and receive treatment in the U.S. or U.S. territories, and citizenship is not required for us. Also, the specific health insurances. Some of the funds, they vary. Some patients may need, or some of the funds require Medicare only, and some of them are open to all insurances. They must be prescribed a medication or a product that is listed and covered by that disease fund, and then have an income that falls at or below the federal poverty level. That range varies. It's typically between 400 and 500%. Now, I know when you hear the federal poverty level, we think of very low numbers. And I just wanted to provide this resource and chart to show you that for a fund that has a 500 FPL, and it is a patient who is in a one single family household, a patient can make up to $78,250 and be eligible to receive financial assistance for that disease fund. And also, at the PAN Foundation, our eligibility criteria is based on household income. So as the household increases, the amounts increase as well. And you can reference this chart. So understanding fund statuses. So the charitable organizations are donation-based, and assistance is available based on funding. So as an example, you may see some fund statuses at the different various organizations. Here's an example of, at the PAN, we have 3 different fund statuses: open, close, and waitlist. Open means that there's funding there. It's open to the general public. One can apply, the patient can apply. You as providers and pharmacists and pharmacies can go on behalf of the patients and apply for them. In the event that that fund is closed, we offer a way that patients can sign up for the wait list. Once funding becomes available, the patients will be notified. We believe in a first come, first served basis. They have 48 hours to apply for that fund. And then after the wait list closes in that time period, then it will open to the general public. So as a pharmacist, as a technician, as a healthcare professional, you are going to look to see if there is an open fund for a patient. There are 3 ways here. So again, as we mentioned, Fund Finder is a very useful resource, or going directly to the Charitable Foundation's website. Visiting fundfinder.org, and as an example, going directly to PAN Foundation's website to see if a fund is open. Most of the foundations have online portals. Again, as an example, at the PAN Foundation, we have an online portal where pharmacists can go and enroll on behalf of their patients. And then also, most of the foundations operate a contact center. One could call in, either the patient, the provider, or pharmacy could call in and start the enrollment for the patient through our contact center. And we also have live translation services. So at step 2 is verifying the patient meets the eligibility criteria. As we went in depth earlier, the financial assistant charitable foundations typically have eligibility criteria. These are standard, again, getting treatment for the disease state, having the specified insurance, being prescribed the medication, and also the income level. And then gathering all the required information. So these are frequently required information that is needed for applying on behalf of a patient. The patient's demographics, diagnosis, the medication's name, the insurance information, income information, and then also the physician's information is needed. And then submitting the application and approval processes. Some foundations have a instant approval process. I will say here at the PAN Foundation, we do have a instant approval process. And then once approved, the patient can begin using their financial assistance. Just to note here, so when one is applying for a patient, or a patient is applying, and once they receive approval, they can use their money instantly here at the PAN Foundation. We provide billing information. At the pharmacy, you go and put in the patient's primary insurance. We are the last payer resort. The patient walks away with a zero copay. Again, how to apply is either online or call it in. And then we're looking at next steps for the approval. Again, some foundations have an instant approval process. Once approved, the financial assistance is there and readily available for that patient, and pharmacies can start submitting those claims on behalf of the patient. So with all of this great information, I'm going to turn it over to my colleague Jessica so that she could talk to you about how to address your patient's affordability concerns.
Thank you, James. As we were talking through all of this great information, it really comes down to the fact that many patients feel uncomfortable discussing the cost of medications. Um, but we as healthcare professionals, as pharmacists and pharmacy technicians, if we have that open communication with our patients, that can lead to more affordable treatment options and better health outcomes. Um, so how do we want to go about holding these conversations with our patients? Again, why does this matter? 1 in 4 patients report difficulty affording their medications. Yet very few will initiate cost conversations with their provider. So we as the healthcare providers, we want to be proactive about these conversations with our patients. If we are proactive in this conversation, we have a better chance of patients adhering to their medication regimen. We earn our patients' trust, and we have improved health outcomes. Next slide. Tips for navigating the conversation. Initiate the conversation early. Um, when a patient comes to your counter and they have the RX in their hand and they're looking to fill it, um, the, we want to talk to them right then and there. Especially in the pharmacy, a lot of times we will do we'll put in the prescription and we'll sometimes do the initial check to make sure the insurance covers it, because we don't want to have that conversation with the patients when they're coming up to the register and they're trying to pick up the medication. So we want to make sure that we start it early. We can also ask them if they're having trouble paying for their medications. If we notice that they might have several high copays on their profile, we can start the conversation. And we can make it generalized. We don't have to make it seem like it's targeting that particular patient. We could say that in general, a lot of people are having difficulty paying for medications, and we can have that discussion and see how we can help them manage it. We never want to make assumptions when we're talking to patients. Um, we want to make sure everybody is given the opportunity to have that conversation with us. So we want to make sure we ask every patient. We take that extra minute to talk to them about that, and then also depending on how what our capabilities are and the environment in which we work in, we can actually look at like actual benefit coverage and help them discuss, well, your insurance does cover this, or they might cover something else. So then that can prompt another conversation that the patient can have with their provider and letting them know, hey, that they tried to get this prescription filled, but it's just out of their price range, and that there is some alternatives that the insurance will cover. So these are just some suggested ways to prompt that conversation, because again, it can be kind of awkward with patients, because they will feel uncomfortable discussing it, because when a doctor prescribes a patient something, they feel like that they have to get that particular medication for a particular reason. And if they can't afford it, then there is a burden on them that they feel. And we are there for our patients. We're here to help them. So we are in this with them, and we want to make sure that we can do the best that we can by our patients. And then here's some strategies to support medication affordability for our patients. Again, there a lot of the medications out there have generics available, and a lot of insurance companies will cover the generics over a brand for costs. You can also always suggest patients to reach out to their insurance and ask their insurance for the preferred drug list during open enrollment. All these great resources that have been shared today, we can refer patients to those programs. Everything has a website or an application or like a phone app or something that is easily for them to use so that they can browse the information on their own without feeling any pressure. Also, when we have a trusted resource for that we go to, that we as healthcare professionals rely on, we can refer those patients to those resources. And also, whenever possible, provide our patients with educational materials about financial assistance. And then tonight's case study. So we have a patient here. She's an 82-year-old married woman with a household of two. She's currently diagnosed and being treated for chronic lymphocytic leukemia, osteoporosis, and high blood pressure. She is currently in active treatment and is on several high-cost prescription medications. During the investigation at the beginning for eligibility, she is on a fixed income of $29,000 per year. She lives in Tennessee with limited retirement assets, and the insurance that she has is traditional Medicare. So this patient in particular, her income falls under 150% of the federal poverty level. Because of that, and depending on the details of her retirement assets, she may be currently eligible for the federal extra help program that was mentioned earlier, which would help significantly reduce her out-of-pocket prescription medication costs. In addition to the extra help program, she is also on Medicare, and she meets FPL thresholds that would qualify her for a number of charitable assistance programs out there to help treat some of her conditions, like the chronic lymphocytic leukemia and osteoporosis, as there's programs out there that will help cover some of her out-of-pocket treatment costs. And then those same foundations may also be able to provide other support to this patient if she needs assistance going to and from her provider's office, or for going to the pharmacy to pick up her prescription. She might be eligible for transportation costs if available.
Thank you all for that excellent and in-depth overview of these important financial resources, both at the PAN Foundation and at so many other organizations. It looks like we've got some time, to about 10 minutes, to go through some Q&A, and we've got some questions coming in through the Q&A box. If you have questions, please submit them now so we can add them to our queue. So I'm going to start with our very first one, and I'm going to direct this one to Dr. Ridley. A question came in about whether there's other types of educational resources beyond financial assistance that the PAN Foundation offers for pharmacies or patients in general to navigate their care.
Thank you, Liz. More than happy to answer that. So one of the things that Sarah mentioned in regard to our mission, we have three pillars: financial assistance, advocacy, and education. Beyond just financial assistance, we also do extensive work around advocacy, policy, champion for change for patients in regards to access and affordable healthcare. Also, education information around clinical trial navigation and reducing the barriers around clinical trial diversity. Educational work in regards to community impact and involvement. So there is a vast amount of information that we do have available. I encourage you to visit our website at www.panfoundation.org, where you will find a wealth of information that you can either use for yourself, to educate and then also to be able to provide for patients.
Excellent. Thank you so much for that information, Dr. Ridley. And we'll make sure to add some of those in the follow-up resources. The next question that's come in is from somebody asking that they'd like to better understand the overall enrollment process and how to get patients enrolled in these financial assistance programs. They're asking if it's possible to do a demo of PAN's enrollment portal and how can they request it. And I'm going to turn that over to you, Dr. McLaughlin.
Thank you, Liz. Yeah, so that's a great question. The enrollment process through the PAN Foundation is very straightforward, and it offers you a couple different routes. You can either do it over the phone with one of our patient support specialists in our call center, or you can also do it online through the pharmacy portal that you can get set up. That's quick and easy from our website. If you go to panfoundation.org and click on the apply now in the top right hand corner. The enrollment process takes about 10 to 15 minutes, and that's also including the instant check for the application. So it's instantly processed at that time for our open disease fund programs, and you'll receive an instant process result. Regarding the demo of our portal, we most certainly can put a training link in the email with the follow-up to this webinar for you to get your hands on seeing the process for yourself.
That's great. Thank you. Thank you so much. This question goes for anybody who would like to respond or for both of you. Someone was saying that, the acceptance from patients of these types of financial assistance resources seem easy, but it could take several discussions to help them feel comfortable with it. Do you have any ideas or recommendations of how to work to convince patients to accept this type of support?
I'll start there, Liz. I think in using the tips that Jessica worked throughout this training is that approaching the patient or approaching the situation, letting them know that one, there are resources available. I think it can never hurt to provide an education and resources to a patient. And if they are a bit reluctant, just also understanding for yourself that each individual approach to a patient is different, and meeting them where they are. Again, as healthcare professionals and providers, all we can do is recommend and provide the resource and encourage them. But I will say in practice, and I often tell this story, is that so many times where I was working in a pharmacy and patients could not pay for or afford their medications. And me coming out of school and even working at that time in retail, I was not educated on these type of resources. So I didn't even have the bandwidth to even offer a resource to a patient. So now that you are equipped with these resources, you can simply just say, hey, these are some of the things that are available to you. They can help you with out-of-pocket costs. You may be eligible. Take a look. And if they're willing, more than likely they'll lean in and ask for additional help or assistance.
Thank you so much for that great advice, Dr. Ridley.